Hey there, everybody. Welcome to HealthWell. Is the pain going to subside on its own? Or do you need to see a doctor or maybe contact an ambulance? How would you know if something was wrong with your heart? Not all cardiac diseases are easily detectable. You won't always experience a frightening chest clutch followed by a tumble to the floor as depicted in films. Certain cardiac symptoms occur outside the chest, and it's not always easy to determine what's wrong. Heart illness is an umbrella phrase that refers to the failure of the heart, irregular heartbeats, various diseases, abnormalities, and birth abnormalities associated with the heart. While it may seem like something this serious should have warning symptoms, it is possible to develop heart disease while going about your everyday life. Therefore, it's crucial to recognize the early indicators of heart disease, as well as risk factors, to ensure that you receive treatment promptly and avoid more serious health concerns. Number 1. Fatigue. Fatigue, lethargy, and excessive napping during the day are all indicators that you may be experiencing the early stages of heart disease. These symptoms may be indicative of insufficient sleep at night, which is a sign of sleep apnea. At night, loud snoring, choking, and gasping for air indicate that your breathing is being severely disrupted. The long-term effect is that the heart is stressed, making it more prone to cardiac problems such as hypertension that is difficult to regulate or heart attacks. Patients experiencing fatigue should consult a physician for polysomnography and home sleep tests to rule out sleep apnea. If you frequently feel drained for no apparent reason, or if you find yourself drained when performing tasks that were previously effortless for you, visit your doctor. Number 2. Shortness of breath. Dyspnea, the medical term for shortness of breath, is easy to dismiss as a concern, as it is more prevalent in persons who do not exercise consistently. However, it may be a sign of heart disease. Something you used to do effortlessly, like climbing a flight of stairs, now leaves you gasping for breath. Shortness of breath associated with cardiovascular disease is frequently caused by coronary artery disease, a weak heart, also known as cardiomyopathy, pericardial illness, heart valve disease, and cardiac arrhythmias. As a result, you will experience shortness of breath during physical activity. Additionally, you will experience breathing difficulties even when lying flat. This is referred to as orthopnea and is a symptom of heart failure. Keep an eye on your sleep quality as well. Paroxysmal nocturnal dyspnea, or PND, causes extreme shortness of breath to awaken you from a deep sleep. This illness is frequently caused by heart failure, and as such, it is advisable to have it evaluated by a physician. Number 3. Angina pain. Angina is a type of chest pain that originates underneath the sternum and is caused by decreased blood flow to the heart due to blockages in the major coronary arteries. Angina is frequently a precursor of coronary artery disease. Some common symptoms of angina include pain in the chest, a sensation of heaviness, tightness, or crushing pressure underneath the sternum that lasts somewhere between 2 and 15 minutes. This condition is usually triggered by emotional stress, vigorous exercise, and heavy lifting. The severity of angina varies according to the type of angina discomfort. Stable angina, the most frequent type of angina discomfort, lasts only a few minutes and comes reliably following physical activity, such as climbing the stairs or mental or emotional stress. Symptoms resolve spontaneously with rest or treatment. This does not necessarily mean that a heart attack is imminent. Number 4. Feelings of dizziness and lightheadedness. Dizziness and lightheadedness on their own are not clear signs of cardiac disease. Occasionally, this can occur as a result of rising too quickly or being dehydrated. However, it is cause for a concern if it frequently occurs or in conjunction with other symptoms, such as chest tightness. Because dizziness and lightheadedness can have various causes, you must contact your doctor for a complete medical checkup. Number 5. Unexpected pain. When most people think of cardiac illness, they immediately think of chest pain. However, discomfort associated with cardiac problems can occur in other areas of the body as well. According to a study, heart and circulation issues can cause pain in the stomach, legs, particularly the calves, arm, particularly the left arm, jaw, and back. Swelling of the ankles may be a sign of heart failure. The majority of people do not associate these symptoms or indicators with heart disease. If you have any of these symptoms or signs, get medical attention immediately. Number 6. Sharp pain to the arm. Pain radiating down the left side of the body is another common heart attack sign. Most doctors suggest that it begins from the chest and spreads outwards, and this is a sign that should not be taken lightly. Number 7. Pain in the throat or jaw. Throat or jaw pain by itself is unlikely to be related to the heart. It is more likely that it is caused by a muscle condition, a cold, or a sinus infection. However, if you experience discomfort or pressure in the center of your chest that radiates into your throat or jaw, this may be an indication of a heart attack. Contact 911 and get medical assistance to ensure that everything is well. If you are finding this video useful and interesting, please hit the like button for the YouTube algorithm. It motivates us to produce high-quality content for you every week. Number 8. Sweating. Working up a sweat at the gym or on a scorching day is nothing to be concerned about. However, feeling hot and clammy in addition to experiencing chest symptoms is an indication that you should contact an ambulance. Number 9. Snoring while sleeping. Sleep apnea increases your chances of cardiovascular disease and other disorders. With sleep apnea, you may experience pauses in your breathing for 10 to 20 seconds or longer while sleeping, which may occur multiple times during the night. Significant sleep apnea impairs the function of the brain chemicals that regulate breathing, resulting in dangerously low oxygen levels. When this happens, adrenaline, cortisone, and other hormones are released in excess, contributing to a range of heart diseases. Because sleep apnea disrupts sleep and raises stress hormones, it is associated with hypertension, which increases the risk of a heart attack or stroke. Sleep apnea may be curable. Continuous positive airway pressure, or CPAP, is a device that provides pressure in the airway to combat snoring and apnea in more complex situations. Number 10. A never-ending cough. This is rarely an indicator of heart problems. However, if you have heart disease or are at risk of developing it, you should pay careful attention to the potential. A persistent cough that generates white or pink mucus may be a symptom of heart failure. This occurs when the heart cannot meet the body's demands, resulting in blood leaking back into the lungs. Consult your physician to determine the source of your cough. Number 11. Suffering from swelling, nausea, and vomiting. Swelling or fluid retention can also be a sign of heart failure, but various factors can cause it. Heart failure, or cardiomyopathy or weak heart, are conditions in which the heart cannot meet the body's oxygen demands. The blood slows and backs up in the veins and vessels, resulting in fluid buildup in the abdominal and leg tissues. The effects of this fluid buildup include gaining weight rapidly and unexpectedly, enlargement of the abdominal cavity that causes your belt area to feel tighter than typical, along with leg edema that begins in the foot and progresses upward to the ankles and shins, and impairment of the kidneys, resulting in a decrease in the efficiency with which water and salt are removed. Consult a physician if you experience any of the symptoms or signs listed above. Number 12. Frequent cold sweats. Everyone sweats after a productive day at the gym or in warmer climates. Sweating is a biological phenomenon that helps to cool your body. While it's normal to sweat under the mentioned conditions, sweating without physically exerting your body or in cooler temperatures is a clear indication of a health complication. And if this cold sweating is accompanied by chest or abdominal pain, then you might be at the risk of suffering from a heart attack. Number 13. Fluid retention. Edema is another term for fluid retention in the body. Edema is characterized as swelling, and it can be due to several causative factors. The position of the swelling along with its distribution helps to identify the causes. Therefore, if you have swollen legs, then this is a sign of a failing heart or a vein malfunction leading to poor blood circulation in your legs. However, if you're experiencing edema due to heart complications, then you will observe a symmetric pattern where both legs will be swollen. Furthermore, shortness of breath is also another serious heart problem, and it is caused by pulmonary edema. For those of you who don't know, pulmonary edema is the unusual fluid accumulated in the lungs. Fluid retention in the lungs is also a common symptom of heart failure. Therefore, irregular fluid accumulation and swelling in your legs or lungs is a clear indicator of compromised heart health. Number 14. Fainting. Syncope or fainting is a brief loss of consciousness usually caused by inadequate blood supply to the brain. While this is a typical occurrence, it might be a sign of heart disease or another significant medical problem in some situations. Heart-related fainting can be caused by various factors, including abnormally fast or slow heartbeats, a weaker or enlarged heart, muscular injury in the heart, or a tear in the aorta. Whatever the cause, you must have it checked out immediately. Individuals who do not seek medical attention may be unaware they have a condition and may allow the cardiac disease to progress, resulting in a terrible prognosis. Do you think you have these symptoms? Let us know in the comments section below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, then please subscribe to our channel.